First of all, let me say that I'm computer illiterate, and so I use slide projectors. I know that's old technology, but you'll just have to put up with it. Also, on your table are some handouts of all of the chiefs of staff, the presidents of the academy, as many medicine residents, surgical residents, and I think radiology residents as I have available to me at the present time. I am trying to develop a list of all the residents that have been at Grandview, and I'm enlisting your help. So if you see any mistakes or if you have anything to add, I would deeply appreciate if you would return that to me with the corrections or any additions. Now also, I've received a tremendous amount of help. I'm trying to write a book on the history of Grandview Hospital. Melvin Krause has helped me tremendously. Dr. Quinn Levin has helped me. Any number of people here in the hospital have given me help. And I have received the most benefit from the corridor gossips, the Grandview News, and the Osteopathers, which are newspapers that have been published in the past by the hospital. And I will try to show some of the examples of these as we proceed. Now, one of the most difficult things that I found when I first came to Grandview Hospital was to try to understand how that conglomeration of buildings actually came to be that we walk through called a hospital. Some hallways go up, some hallways go down, some run into blank walls, and etc. And believe me, there was no information as to how that structure came to be what it is today. And so what I'm going to try to do first is go through the building projects and how they came to be and discuss the hospital physical plan. I also want to go into several new areas that I haven't presented. I want to discuss the administration and the hierarchy of people that have come to administer our hospital through the decades. I will try to go into some of the staff development and how the staff came to be. And then I want to talk about how important education has become to Grandview Hospital. So that's where we're starting. And any time you start talking about Grandview Hospital, you have to start with 2nd Street, which was a large house built in the very first part of this century, or the 20th century, last century. I keep forgetting. And you also have to realize that parallel to the purchase of this house by Dr. Grandview, who was the first physician to practice there, was the development of a small hospital in Lebanon in Warren County. And that was developed by 2 brother-in-laws, Dr. Dill and Dr. Dillatush. And ultimately, Gravitz went to Warren County and talked with the Dill and Dillatush and convinced them that it would be better for everyone if they came to Dayton and joined him in this hospital, and they formed a clinic called the Miami Clinic in 1928. Dillatush continued to do surgery in Warren County, and he would travel back and forth with a bag full of surgical instruments. He did have a reflector that he would do home surgery with in Warren County. He would attach it over the light in the kitchen. The patient would be placed on the kitchen table. He would sterilize the instruments first by boiling them in water, and later he did own a pressure cooker, which he sterilized his instruments in. Dr. Dillatush had some surgical experience from the Detroit area, and also I've been told that he and several other surgeons in this general area would meet in the Detroit area and operate on dogs to determine or to develop some of their skills that allowed them then to come back and do surgery on human beings. This clinic started off with about 5 beds, and it developed slowly over the next 20 years till there was a maximum of 44 beds. Now in 1939, Dr. Grandview decided to retire. He sold this building to Dill and Dillatush. Now, they wanted to form a hospital, and in order to incorporate in the state of Ohio, you had to have 3 people on the incorporation papers. So they took in with them young Dr. Doberleit. Doberleit was working on the assembly line of a General Motors plant here. He was playing professional football, semi-professional football, and working as a mechanic occasionally, and kept all of the equipment in this building running because he was an excellent electrician and mechanically minded person. He also became the first radiologist in this clinic. Now, in 1939, they formed Dayton Osteopathic Hospital. They happened to file the papers on December the 7th, 1939. Now, everybody knows what happened on December the 7th in 1941. Some people west of here dropped some bombs on a small island, and we went into a major war. Now, that affected Grandview Hospital dramatically because by 1941, they were bursting at the seams at 2nd Street and needed to get out of there, and were already planning to move to another location. That location, ultimately, in 1942, was a cornfield on Grand Avenue. And they purchased this cornfield for $13,000 and started planning on the building of the hospital. But there were several governmental institutions. Was it WPA, Work Projects Administration? WPA. I was a little puppy. No, I think it was they were still going on during World War II. And that kept them from being able to build anything you wanted in the United States. Because of the war and all of the problems with the Depression, you couldn't just go out and build a hospital. So they had to wait, and that hospital did not come to be until 1947, and that may be the... What I'm going to show you here is the inside of 2nd Street. This hospital was built by a person that owned a lumber yard here in Dayton, and he made each room out or decorated it with wood of a different type, and a very ornate stairwell in the entranceway to the hospital, and every room was done in this ornate fashion. This is the original surgical suite, and this is a World War I surgical bed that was purchased from the U.S. Army after World War I. This is the original lab that was down in the basement, and this is Charlie Hoysh, who became the head clinician, head of the clinic at Grandview Hospital. When I came to Grandview in 1971, Charlie Hoysh was still head of the lab, and his son was an orthopedic resident at Grandview. This is the radiology department at 2nd Street, and Dr. Berger told me he actually saw Dr. Doberleit under there with a screwdriver and sparks flying, and he was repairing the X-ray machine. In 1944, prior to 1944, the interns had to carry the patients up the floors, and this was a 3-story building, on stretchers. But in 1944, they built a ramp in the back, and they had to push the patients up on the carts. And Dr. Morgan George tells a hilarious story of losing control of one of those carts and the patient coming down, and certain bad things did happen to them on the way down. This is a delivery room in 1944, but up until that time, they had no delivery room, and the patients were delivered in the beds of the hospital up until about 1944. Now, in 1946, they began the construction, and this is the original construction pictures of Grandview Hospital, where it sits now on Grand Avenue. By the way, I mentioned that it was a cornfield, and during World War II, the hospital allowed employees to use it for victory gardens on that very site where they purchased the land. And this is the hospital that was built. It doesn't show it in this picture, and I will point it out to you later that it was an H-shaped structure. And it was very difficult for me to find where this lay in the midst of all of the construction that's gone on since. But if you go up to about the 4th floor and go to, I guess, the east end of, or the west end of the new hospital and look down, you're looking on the top of this building right here. And you can see the H-shaped structure there. In March, on a Sunday, I think it was the first part of March in 1949, the patients were transferred at 4 o'clock in the evening, and the staff, doctors, and their wives helped transport the patients from 2nd Street to this hospital. Now they opened up 44 beds in the hospital, which was the number that they had over at 2nd Street, and they left 23 beds for obstetrics on 2nd Street at that time. So that in 1947, in March, there were 2 facilities of osteopathic hospitals in Dayton, one on Grand Avenue and one on 2nd Street. But by October of 1947, all of the obstetrics had been moved to Grandview Hospital, and they closed 2nd Street totally at that time. Now, the hospital already was starting to burst at the seams. They hadn't planned ahead. They needed to build more. So by 1949, they went into the basement of this building and reconstructed the whole basement and added more beds and eventually had 90 beds at this little H-shaped hospital on Grand Avenue. And yes, as I'm saying, if you want to go to, I think it's the west, the new buildings run east and west, doesn't it? Or is it north and south? Well, then go to the south end on the 4th floor, look through that big glass window, and look down on the gravel on the roof of that building, and that's the roof of the first hospital. It's an H-shaped structure, and you will be able to recognize it right off. Do you understand? But a new surgery was built in this new building, and by notice this little sand clock. Do you see that? They had to scrub for 10 minutes by a sand clock. And these are some of the... Don Burns, sitting here tonight, told me he remembers scrubbing by that cotton-picking sand clock. The one thing about Burns is he's getting old and his memory's failing. He could not tell me what this is, and I'm very interested. If anybody knows what that is, or anybody has been in that old building when this was going on, it looks like some kind of funny character or something stuck up on the wall. But I don't know what it is. Maybe it's just a bad spot in the wall. In 1949, 2 rooms in the new expansion was dedicated to pediatrics. I was trying to get Dr. Jarrett to be here. Is he here? He isn't here. Dr. Jarrett was the first pediatrician. He actually left, I think he went to Des Moines. Did he not, Don? Huh? Chicago, and took his residency? Where did he take his pediatric residency? Wasn't it Des Moines? Des Moines. I think it was Des Moines. And he came back and started a residency in pediatrics at Grandview Hospital and turned out some tremendous residents. And Neil Canner, who is the neonatologist at Miami Valley Hospital right now, running the big neonatology unit there, was a resident trained in that residency program at Grandview Hospital. His wife, Mrs. Jarrett, and I don't know her first name right off, I'm sorry. What? Eloise, right. I didn't know how to pronounce it. She actually was the scrub nurse for Dillatush and Doverlight and knows a lot of the history of the hospital. And I was hoping to have her here tonight, but they were not able to be here, much to my regret. But at the same time, the very first room in Grandview Hospital dedicated to internal medicine appeared. All other beds prior to that time were considered for surgical purposes. And if you were... But we did deserve a single room, don't you think? If they had 2 for pediatrics, surely they could spare 1 for medicine. Yes, sir. there were fund drives, and the hospital staff was also asked to contribute, but in a forceful manner, I think, if I remember correctly. There were certain meetings, and you were assigned a bill. Assessments, yes, that's a good word. Hi, how you doing? Good to see you. Actually, Grandview also, did that answer the question? But there's always been a history, from what I can read, that the staff of this hospital funded this hospital to a great degree. They did it many times complaining and reneging, and there are always notes in the board of directors meeting that they're sending their bills to Dr. so-and-so, and his name is going to be posted in the dining room or something of that matter. But the fact never goes away that it was the doctors of the hospital that was putting up their money for the hospital. Now, other people did as well, so don't get me wrong. We didn't fund the whole thing. But there was a significant amount of money given by the staff to develop the hospital, to get it where it was, and help pay for this lady's salary that was our first telephone operator in Grandview Hospital. Okay, do y'all remember her? Okay. Now, in 1951 or so, it became obvious that a new expansion was absolutely necessary, and this was the architect's dream. They were going to put 2 more rooms on top of the original. Now you can see the H-shaped structure of the hospital. And also, I want you to notice that there's a little cattywampus piece here on the original building, and that was because they didn't own the land beyond that on the east end, and so you can't build a building right up to the property line. You have to stay so many feet from the property line. So they turned that. That was where obstetrics was, and the basement was where the intern lounge was in the original hospital in 1947. But lo and behold, they got to checking. They had been told they could do this. The architects, and I've had some recent problems with architects, the architects had made a mistake, and the foundation would not hold 2 more floors to go up on top of the original building. So they had to come up with a different plan, and the plan that they came up with involved coming out in front of the original hospital. This is Grand Avenue. The original hospital set fairly far back from the street, so they decided to build the new expansion out in front of the original building and connect it. And this is the result of that building. And it was a 3-story building and added about 80 beds to the present bed total. And this was completed in 1952. Even by the time this building was completed, again, they were having trouble getting patients admitted. There were 30-day waits on getting some. The emergency room was full. You couldn't get anybody in a bed. People were in the hall on carts. So they had to build an expansion, and in 1957 built the obstetric wing that sits off to the side, almost kind of a freestanding structure until you get way to the back end of the building, which used to be Shaw Avenue, which doesn't exist anymore. This added 55 more beds in obstetrics, and it was a 2-story structure and was immediately filled. Didn't take any time. This building was filled, and that building was filled. And in 1955, they purchased that apartment building across the street, which some of our house staff live in even today. I don't know if everybody remembers that building, but sits across the street. Hilton, yes, Grandview Hilton was purchased about 1955. But by 1962, again, they were in a crisis state, and it took another major building project, another big fundraiser, and etc., and they added 2 more stories on top of the 1952 structure. So this is the 62, 1962. And immediately that was filled. There was never a time when they didn't underestimate how many beds they needed. They were growing by leaps and bounds. People were coming on the staff. The internship program was growing. The people in the internship were staying. The practices were growing, and the patients were being admitted to the hospital faster than they could build the beds for the hospital. So in 1970, well, here's the way it's set. Let's stop here. This is, say, at the end of 1962. And you can see the original H-shaped structure with the little catty corner part that didn't want to get up to the property line. So this is the original building. They added a 3-story structure in 52. They added the maternity wing in 57. They added 2 more stories on the top of the 52 building in 1962. And somewhere in the 50s, and I think it was 55, they purchased the Grandview Hilton here across the street. And about that time, some of the doctors, Dr. Quinlevin, I think you were involved in this, were you not, built this office building. What year was that? Do you remember the year? About 1960. So this building, which housed several physicians from Grandview Hospital, was built. It was a private facility, did not belong to the hospital at that time. They did have the laundry, but the parking garage wasn't there. The annex did not exist. Now this picture was taken in 1970, 69 or 70, because this is built. Now it's taken from the back of the hospital, and this is the only aerial photograph that I have seen taken from this position. All other aerial photographs are taken from the front of the hospital so that you can see the front of the Grand Avenue area. This one was taken from the back, and I think I know the reason. Because they had just built the 1970 surgical addition, which included a new intensive care unit, a new recovery room, a full new surgery, and a new number, I think there were 60-something beds of surgical patients here, and a new emergency room that opened out on Shaw Avenue. And the annex had been built, and a tunnel had been built across from the annex, from the main hospital to the annex, and the top floor of the annex was open. But they couldn't get enough parking on the street, and the city of Dayton would not allow them to open all the other floors in the annex, so they needed to build a parking garage. And I think this photograph was taken because the parking garage is going to be, I think it's right in here is where it's going to be. And so I think that's what this photograph was for, was during the development and the planning stage to develop in 1971 the garage. Now I have pictures of Mr. Cano that I will show later on, who was administrator in the 40s. But in 1971, he was invited back to give financial advice on how to purchase and pay for the parking garage that you see. Man, did he cut through the staff. Bam! He cut departments. He cut people's jobs. He cut, you can't believe. And the guy that was doing it for him was Richard Miner, who was assistant administrator of Grandview Hospital. We'll get to Mr. Miner in a minute, because he has some neat history here to talk about. But anyway, that was called the austerity program. Does anybody go back to the austerity program besides? Do you remember that, when we couldn't get anything? Nothing happened at Grandview because we were trying to save the money and put it in the bank to buy the bonds to pay for the garage so that we can open the annex. Well, anyway, that did come about, and the garage was purchased. So this was a situation as of about 1971 when a young doctor from Texas came and started his medicine residency here. I busted my ass right here. I came in the winter, and this was a sheet of ice, and I stayed in the Hilton, and I walked across the street in this flimsy little Texas overcoat that I had, and my feet went up in the air, and I came down, and I thought I had died. But I didn't. But this is the way it looked. Here is the original building tucked back in the back. Here are the two additions, the 52 and the 62, and alongside is the 57 maternity wing, and then the big building expansion in 70 with the surgical suite and the intensive care unit, the new surgery, and back in the back a new emergency room. The annex had been built as well, and the physicians that owned the physician building here had actually allowed, either sold the land or allowed Grandview to build a tunnel underneath because they actually owned that property at that time. And there's a tunnel that goes between the building here over to the annex. And in 1978, the Ambulatory Care Center, does everybody remember ACC? A new concept of hospital without beds, was built out on 725. It contained a full emergency room, laboratory, pulmonary department, cardiology department, rehab, and etc. Now, I think there was surely plenty of plans to put beds there, but it was touted as a hospital without beds. But in 1983, 50 beds were moved from Grandview and placed there and became Southview Hospital. Of those 50 beds, there are 7 intensive care unit beds, and I didn't know until fairly recently that the state didn't authorize but 6 intensive care unit beds. So one of those beds is actually considered a holding unit, and the hospital cannot charge price or ICU bed price for that particular bed, even if the ICU is completely filled. And at the same time that Southview Hospital was being built, there also began then the construction of the newest addition to the hospital, which was opened in 83 as well, 84 maybe, 1984. And that then led to this configuration of the new hospital addition, added on to all of the additions I've gone through, plus the hospital purchased, I believe, in 89, the physicians building, and OU built the present OU building, which houses our library. And that is pretty well the way the building structure of Grandview Hospital looks today. Yes? Now I'm not sure. I just heard the other day that we actually owned it, but I thought we had leased it. Huh? We never owned it, did we not? All right, I think that the annex was leased, and if I'm mistaken, somebody can correct me now, but I think it reverted back to the people that built it, and I don't think we actually own it now, and we have some arrangement probably financially with the owners, because we certainly support that nursing home that's there. Is that correct? All right. Now, I want to go through the history of the administration of Grandview Hospital. The good, the bad, and the ugly. And I will tell you that I think it is primarily good, because if you can look at this staff as it's developed, it's like 50 horses trying to go in 50 different directions. And here is one guy trying to lead them off in one direction. And it's almost impossible. And so there's going to be animosities, hostilities, and all kinds of derogatory statements, and etc. But let's just go through the administrators as I see that we've had. First came William Gravitt, and he bought this property on 2nd Street in the early 20s, and he developed it into a clinic, and he got the physicians to come there, and he was the head man up until 1939 when he sold the clinic. I know nothing about his education except that he was the first osteopath to come into this general area, or one of the first, Ryersburg, and I'll show you that later on in the development of the staff. But he was in Dayton, Ohio, probably by 1910. And I know the oldest telephone book I can find in the library is 1919, and he is in it. So he was here very early in the history of the osteopathic profession. Now, when he sold the building, he sold it to Dill, this is Heber Dill, and he sold it to Dr. Dillatush, Frank Dillatush. Heber Dill became the superintendent of the hospital and the chief financial officer of the hospital. This was in like December of 1939. By about February, he has his friend, Arnold A. Fricke. Now, if anybody has a picture of Mr. Fricke, I will beg, borrow, steal, or buy it from you, because I'm unable to find any photograph of Mr. Fricke. But Mr. Fricke was a stockbroker, and he was a personal friend of Heber Dill, and he advised Dr. Dill on his financial ventures. And they hired him to be the chief executive officer for Grandview Hospital. And they paid him $50 a month to be paid twice a month on the 1st and the 15th. So he got $25 on the 1st and $25 on the 15th. This went on for about a year. He was raised to $100 a month. 6 or 8 months later, he got $150 a month. By the end of 1941, he was making $150 a month, Mr. Fricke was. Now, Dr. Dill had been paid for his services in the early part of this hospital program by free office space in the 2nd Street Hospital. Immediately upon hiring Mr. Fricke, Dr. Dillatush says that he thinks Dr. Dill ought to start paying for his office space. So there was quite a little bit about money going on here early on in hospital history. But Fricke, in December the 20th, 1942, gives the board of the hospital an ultimatum. If they don't give him a raise, he's going to resign. So there's a great big meeting, and they accept his resignation. And immediately upon the acceptance of Mr. Fricke's resignation, Dr. Dill resigns. Now, Dr. Dill was the very first internist, so to speak. He has the Distinguished Service Award, and that for being the first internist at Grandview Hospital. But he did resign, and you never saw his name appear in the board of directors meetings until 1945 when he died, and there was a eulogy for Heber Dill at that time. Now, on the night of December the 20th, 1942, the hospital was in desperation because they have accepted the resignation of their chief executive officer, and the guy that had the job before just resigned as well. So they called the next morning to the Ohio Osteopathic Association, and at that time the executive secretary of the OOA was a guy by the name of William Cano. Now, William Cano is asked what he thinks they should do, and he says, "Why don't you hire me?" So by the 21st, he is down in Dayton, and for $200 a month, they hire William Cano. Now, William Cano, that's the best picture I can get. Y'all just have to put up with it, okay? But William Cano was a pretty sharp dude. Now, he was also the hospital administrator in Columbus, and he was also the hospital administrator in Epp. And he was kind of a part-time hospital administrator. And he hired a woman to come to Grandview by the name of Treadway. Now, I have various names, Edna and Joan, I think. Does anybody really know what Treadway's first name was? Anybody remember or heard of her or anything else? Well, this woman was the chief executive officer, but she couldn't do anything without calling up to Columbus or wherever Cano was and getting his okay that it was all right to spend the money or do whatever it is they wanted to do. So people were kind of upset and felt that Cano was sort of a part-time administrator as well. But if you go back to the written record, this guy wrote some of the best critiques of what's gone on in the year of a hospital that he presented to the staff and to the board of directors of any of the directors or chief executive officers that I can find. And I will tell you that Mr. Miner was kind enough to allow me to have all of the minutes of the board of directors up until when he left the hospital. And I have been able to review those minutes closely, and I can tell you that this man right here could write a heck of a document, okay? He would give you a critique that was excellent. He had his finger on everything that was going on in that hospital, even though he wasn't here all the time, and he did have his assistants running the show. But suddenly, in 1946, he resigns. Now, it doesn't say why, but my suspicions are that it probably was over. He wanted a raise as well. But he resigns, and this leaves the hospital board in a predicament, and you can tell from the minutes that they're upset. They didn't expect this because they immediately asked him to accept a position as a consultant to the hospital at $2,100 a year, where he only comes once a month and gives a professional consultation for how the hospital is doing or what it should do. Now, this led to some animosities later on, but this was in the minutes of the board of directors. This was the board of directors writing it down as what they wanted to do. So he went off to do this job, and the hospital went off to find themselves another administrator. And within a month, they had found a man down in Cincinnati by the name of Joseph Back. Now, Back, anybody remember Joe Back? All right. This man was also one heck of an administrator. Now, he came from Jewish Hospital in Cincinnati, and he had also at one time been an employee of the Board of Health in Cincinnati. So I do not know what his educational background is at all. All I know is that he came from Jewish Hospital and had been working for the Board of Health. But he started in 1946 as the Chief Executive Officer of Grandview Hospital. And I don't think he liked it at all that Mr. Cano had been retained as an advisor to the hospital board, because it didn't take him long to get rid of Mr. Cano. Now, Mr. Back, let me go back to him. Mr. Back remained at Grandview Hospital for 23 years. There's only one other administrator that's been here longer, and that's Mr. Richard Miner. He was here 26 years. Mr. Back was here at the time of the greatest growth of the hospital. The 1947 move, the 1949 remodeling, the 1952 expansion, the 1957 building program, the 62 program. Even was here when the 1970 program with the new surgical addition, he was the one that got it started. Miner finished it, but Hunsaker finished it. But Miner, God, I'm getting my names all screwed up here. Let me stop, I've had a stroke here. Back started it in 69, and Mr. Hunsaker finished it up in 70. But he did retire in 1969, and the man that was hired at that time came from Michigan. And he had been the Chief Administrative Officer for Highland Park General Hospital in Michigan, and he also had worked in Brockton Hospital in Massachusetts and Children's Hospital in Columbus. He had a Bachelor of Science degree, and he had a Master's of Science degree. So he was, up, as far as I can tell, up to this point, the best educated and the most experienced administrator that the hospital had gathered together at any time. Now, I've talked to any number of physicians about Mr. Hunsaker that knew him. He was a shrewd, sharp individual, and he had a lot of progressive ideas. He is the one that really started the development of a hierarchy of chain of command and began to develop assistant administrators and things. But he had one problem. He liked to drink alcohol. Now, there came a time, and I've heard this from too many sources, that Mr. Hunsaker one night was arrested for driving while intoxicated in the city of Kettering. And it just so happened at that time that the chairman of the board of directors was Paul Price, who was the chief of police of Kettering. Dayton? Was he the Dayton chief of police? Okay. I'm corrected. He was the chief of police in Dayton. And this happened in Kettering, if I'm not mistaken. And I will tell you that it was very soon that Mr. Hunsaker resigned. So he resigned like almost immediately. Now, Mr. Hunsaker, in the development of the administration of the hospital, had hired a young administrator out of Good Samaritan Hospital who had been trained in Xavier University down in Cincinnati. That young administrator had done a lot of the hardball work for Mr. Hunsaker. For instance, there was a very hostile confrontation between administration and the radiology department on the management of the radiology department in the in about 69, 72 period. And the assistant administrator was required to carry all the water on that deal with the board. But it made him shine in front of the board. He did an excellent job. If you go back and look at the minutes of the board of directors meeting of how that problem was resolved, that young administrator did a good job. He also had to carry all the water on the development of the relationship with the annex. And that was done in a very professional manner with expertise. And he also had to carry all the water on all of the cost containment that Mr. Mr. Connell said ought to occur to get the parking garage built. And that young administrator was the next chief executive officer, Richard J. Miner. Now, I will tell you that if you go back and look and talk to people, no administrator has gone by the way without a lot of criticism. And I think Mr. Miner has carried his share of criticism. And I'm not here to defend Mr. Miner. I just will tell you that in the written record, this man has really done a tremendous job for this hospital. Now, he worked with Corwin Nixon when the insurance programs were trying to cut Grandview and all osteopathic hospitals out totally. And believe me, those guys went to the wire. Mr. Miner developed a bleeding ulcer over that. Does everybody remember that? Got himself sick fighting for us so that we still have a hospital. And they got the law of the state of Ohio changed so that they had to pay us, by God. They couldn't cut us out. And that's all we wanted. We didn't want to make any, we just wanted to be there and play ball. And they didn't want to let us play ball. And this man and Corwin Nixon saw to it that we're still playing ball today. Now, that brings us to 1999. In 1999, we became a religious organization because we were sold and bought out by Kettering Hospital. At that time, we received a new chief executive officer, Dr. Chu. Now, I will tell you that at this point, he's the finest educated man that ever ran Grandview Hospital. He has a Bachelor's of Science degree from University of Missouri, 1976. He came shortly after that to work for Kettering Hospital, and in 1980 through 1984 took an educational leave of absence. And in 1980, he received a Master of Science degree from the University of Dayton here in Dayton, Ohio. And in 1984, received a PhD from Stanford University. And in 1999, took over control of Grandview Hospital. So he's a well-educated man. I have not really run into anybody that's had any trouble with him. Nobody's throwing any bricks at him yet. So we're here to wait and see what will happen, but this is our newest administrative officer. So I've tried to go through the entire history of who ran this hospital throughout the last 75 years or so. And I think we've been blessed with some very good people that kept us in at least the direction that we should go so that we're still here practicing medicine as osteopaths. Now I want to go and develop the staff a little bit. This is, I think, 1920. The only reason I have the 1920 phone book is I got a better photocopy of it than I did of the 1919. But there were 5 osteopathists listed in the Dayton phone book, and they followed the ornamental iron and construction work. Now, in 1921, the first female physician, D.O. Cleanne, we had a little discussion the other day, I think. I don't have a slide made out of that yet, but the very next telephone book contained a sixth osteopathic physician. And I think, let me go along here. This young lady, Elizabeth Leonard, came to Dayton, Ohio, and began to practice, and did practice some at Miami Clinic, and did not join the staff at Grandview Hospital at any time. I'm not sure when she left. But in there is Dr. Greathouse. Remember that name because we're going to run into him again. Dr. Gravitt, we're going to run into him again. Dr. Cosner, I took care of his son who died of a heart attack at Grandview Hospital. McGowan and Dr. Stout. I have a picture of Stout. I don't have of Dr. McGowan. But now the first one of the early, yes. That's Dr. O.G. Stout. But I think we need to look at old Dr. Gravitt, because Dr. Gravitt came to the Greenville area in like 1898. He ultimately moved to, it starts with a P up here, other side of Troy. Piqua. Went to Piqua, then down to the Troy area, and by 1910 was practicing in Dayton, Ohio. The interesting thing is that in 1900, when he was practicing over in Greenville, he was arrested for practicing medicine. Now that case went all the way to the Supreme Court of Ohio and actually was found in his favor, and it changed some of the law of the state of Ohio as to the practice privileges for osteopathic physicians. And this is a 1939 photograph, 1939, of the Noontide Club. Now, Dr. Dager told me that they would meet downtown in a hotel like Biltmore Hotel for lunch. And he said they would discuss medical subjects. And one day they were discussing penicillin when it first came out. And a couple of the guys said, now that's anti-osteopathic. We've got to stay with manipulation, and to hell with this penicillin stuff. So I don't know whatever happened to the guys that were anti-penicillin, but they... Anyway, I think there are like 29 physicians on here. When the staff was formed, there were probably 40. So most of them belonged to the Noontide Club, and it met like on a weekly basis to have a little lunch and to get together for some medical education. Now, I thought this was actually the first minutes of the meeting of the Academy in Dayton, but I'm mistaken. But Dr. Dager was the secretary, and it's dated September 16, 1942, and it says the first meeting of the Ohio Osteopathic Association of Physicians and Surgeons called to order by the president, M.D. Carter. But this is the first minutes that I can find of this organization that sits here tonight. And it's dated 1942. And if anybody has any older minutes than that or knows where I can get my hands on them, I would appreciate it very much. There are two things I want to point out. Number one, Dr. Greathouse is at this meeting. Now, Greathouse was here in 1919 and probably before, but in 1942, he's sitting there at the Dayton Academy meeting, and he says, look, this is during the war. And he's saying, people are trying to get you guys to give them medical disability, so they didn't have to go and fight, you understand? And he was saying we ought not to do that. And I think most of us agree that we shouldn't do that kind of thing. Dr. Quinlevin, was there something you wanted to say? Oh. All right. I also want to point out that the primary thing that happened at the Dayton Academy of Osteopathic Medicine in 1942 was education. And I think that's true right up to today. And a Dr. R.P. Baker from Lancaster, Pennsylvania was asked to come down, and his item was importance of case histories in surgical diagnoses. Now, I have a lot of minutes of this academy, and they all are dealing with some educational aspect. Everyone that I have has dealt with education at almost every meeting that has been held. Now this guy right here is Emerson Early, and he caught this little bitty marlin, and they made it out to be some kind of a land whale or something. But now Emerson Early was quite a cat, and he is a driving force, I think, behind the development of our hospital. Because Emerson had an office and a clinic on about the 1900 block of North Main Street, and he developed a small hospital back in the early 30s. And I think that Dillatush and Doverlight and Dill saw this as direct competition, because Dager told me that he delivered babies and took out tonsils in Early's clinic. And so that was what the stimulus was for Dill, Dillatush, and Doverlight to form the corporation and invite all of the osteopathic physicians onto the board or onto the staff of their hospital. And they sold the hospital to them in 1940, so that all of the DOs in Dayton had a vested interest in the hospital on 2nd Street. And it was because of this guy. All right? Now, Emerson, his daddy was a dentist, and his daddy had an x-ray machine. And Emerson was at college, and he heard that x-ray was good for acne. So he would come home, and he had acne, and he would x-ray his face. And he knew squat about dosage. And he burned himself, and he had this burn mark on his face for the rest of his life where he had overdosed his face with radiation. Not only that, Dr. Krause was telling me tonight that he had cancer in the tips of his fingers or something where they were rotting off from because of his overuse. Now, Dr. Burns, can I quote your little story? All right. This guy was kind of an entrepreneur. So there come a day when his x-ray machine broke and he couldn't get it fixed. But he continued to x-ray people. And he had a set of x-rays. So he would show them his chest x-ray and tell them it's their chest x-ray, you know. Or their back x-ray, he would show them their back x-ray. Now, I also heard a story just the other day, and I hate to hurt old doctor. Anyway, Emerson liked to drink. And so he got picked up for DWI. But he was on the list to become chief of staff. Now, if you look at that list of chiefs of staff that I have, Carl Gebhardt is chief of staff 1950-1951, and that's about the time when this occurred. And I think they knocked old Emerson off of being chief of staff, and Carl had to pick it up and carry it 2 years, because nowhere else are there 2 years in a row until you get, Allison, did you tell me you were the first one 2 years in a row? All right. What year was that? Yeah, what year was that? What year was that, Allison?
1800.
She's got to go to my list to find out what year. 91. Well, this was in 51. So 40 years earlier, this occurred. So I can't vouch for the veracity of this statement, but it's certainly a neat story, and it fits with everything that I've heard up to this time. Now, this is Dr. Dillatush. Dr. Dillatush was a heck of a guy now. There's going to be some criticism I'm going to tell you about in a minute, but I also want to tell you about this case. About 1944, they delivered a woman at 2nd Street of a 12-pound something girl. 12-pound, 9-ounce female. Promptly lacerated the mama's cervix. Hemorrhaging all over the place. As the baby comes out, her bowel herniates into the cord. As they try to take the baby on out and get the placenta out, the entire bowel herniates out through the umbilicus, ripping the cord. All of this is in here if you want to read it. Come up and you read it later on. So they got this newborn infant with their entire large and small bowel out on their belly through a pinhole. You know how big the umbilicus is. Certainly it had compromised the vascular system of the bowel. But they had a mama who was hemorrhaging to death at that time. So Dilatush attends to the mama, which the story says it took about 15-20 minutes to get that under control. And then turned his attention to the baby, which he had placed a moist compress over the bowel of the baby. He finds that he can't get this to go back through the umbilicus, so he makes an incision inferiorly and superiorly from the umbilicus and tries to put the bowel back in. Well, by that time you can imagine the amount of edema. Not only that, there was bowel gas there, and there was no way he was getting this bowel back into this little bitty fetus or young baby. Baby's still alive. So this old sucker goes and gets a great long syringe and about a 20 cc vacuum and aspirates the air out of as many parts of the bowel as he could. Now, I mean, he's sticking a needle in a bowel, do you understand? So he has to be contaminating something. This is certainly not sterile technique. But he was able to reduce the size of that bowel and get it back into the abdominal cavity of the baby and close it. And in, I think, 5 or 8 days, mama and baby both went home well. Now, that's a heck of a damn surgeon. That's 1944, man. If that happened today, what would go on around here? You know, we'd be sucking some wind, I'll tell you that. This is not the mafia. This is Dr. Doberlite, who was our first radiologist at 2nd Street. This is Dr. McCauley. Now, McCauley served a preceptorship in surgery. Am I mistaken? He became a surgeon, did he not? Huh? ENT surgeon? All right. And this is Dr. Ritz, a general practitioner. Anybody remember him? All right. Now, I can tell you that this happened at 2nd Street, but this identical situation happened at Grandview Hospital multiple times because early in the history of this hospital, the radiology department was the seat of academic medicine at Grandview. Everybody gathered together to try to figure out what was wrong with the patient in radiology because the radiologists had more answers than most anybody else had at that particular time. And so you would see the surgeons, the family practitioners, the internists, whoever, they all gathered together, and I'm sure if you talk to any of the people that are here that served during that period of time at our hospital, they'll tell you the same identical story. That's the way it was at Grandview. And it also started that way at 2nd Street. Now here are some people. Henry Shade, anybody know him? All right. Don Levitt. Morgan George, I just talked to him on the phone yesterday. David Seal. All of these guys practicing at 2nd Street, and I think they were in practice at this time. Don Burns and I went over this picture the other night, and we don't believe they were house officers at that time. I think they were all on the staff. They were going over charts at that time. Now, some of the things that were happening at Grandview have really led to how vibrant this hospital has become and how strong it has become, because this is a letter from a Dr. Sprock over in West Virginia. And Dr. Sprock goes through his education in ophthalmology, and he is an he's an eye surgeon over in West Virginia, and he wants to come and operate with Dr. Leidig, who was becoming very, very famous at that time throughout the osteopathic profession as an eye surgeon. And so he writes to Dr. Cosner, who I think was the chief of staff, asking if he could get privileges. Now, I can guarantee you what's going to happen here, because he got his privileges. Bang. He's allowed to come from West Virginia to Grandview Hospital and scrub eye surgery. And I'm sure he was bringing patients with him. Everett Wilson tells me that he had patients that would be sent from Florida, South Carolina, places like that, to Grandview Hospital for whatever procedures they had to do. And the hospital was growing by leaps and bounds because we were developing these departments that could care for these kind of problems, and it was known throughout the osteopathic profession. And the other guys wouldn't help us. They just wouldn't help us. So if you had a problem, either you lost the patient by giving it to the other guy, or you sent it here, and we sent it back to you. What's happening south of town right now? What's the maximum number of babies delivered out there in that brand new obstetrical wing out there? We got any obstetricians here? Is 17 babies in one day still a pretty damn good number of babies? Huh? I think so. And this happened, I think, in like early 1950s. Now, all of the family practitioners delivered babies at Grandview Hospital. They all had privileges, or most of them that wanted them could get them. This is what was happening to cause all of those building projects. We were delivering babies, and the practices were growing by leaps and bounds because of it. Now, there came a time when we had a very good pathologist, Dr. Alvarado. And Dr. Alvarado kept saying, look, we've got a lot of normal uteruses down here. And he would go to the surgery department and say, you know, why is this happening? And so he actually would go to Dr. Dilatush. And in fact, what they did, all of this, because there was resistance to the educational program of taking out normal uteruses, they formed a tumor board at Grandview Hospital. And it was one of the very first tumor boards around in either profession. And guys like Fox and Bodette and Alvarado and Jim Elliott. Everybody remember Jim? Jim Elliott. This is our surgeon. We had an internist, Esselman, radiologist, and pathologist. And believe me, it got to a point where if you wanted to admit a patient to Grandview Hospital with a tumor, these guys had to examine that patient, question that patient, and if they didn't agree, take your patient home. He's not getting in this hospital. Because they were the authority. And they determined when a patient could be admitted. But they also set out on a dog and pony show across the United States of America. And they said, this is how we diagnose tumors at Grandview Hospital. And they had radiology people there. They had pathologists there. They had surgeons there. They had internists there. And they brought it all together in one of the best programs going. And everybody in our profession asked them to come and explain how it happened at Grandview Hospital. Because we suddenly became, because of this tumor board, one of the outstanding educational institutions in the osteopathic profession. Now, they went back to Dr. Dilatush. Now look, this 23-year-old girl's got a normal uterus taken out. Why'd you do that? Said it was flat on the top. The uterus was flat on the top. Now, I'm not a surgeon. I don't think that's an acceptable reason to take out a uterus. And I asked a few people, did it actually change anything? And they felt that it did. That the education and the asking of the questions and the bringing out of this situation actually caused evolution to occur. And some of these old Neanderthals, believe me, I can tell you, Neanderthals will change if presented with the proper way to change. And so I think this is part of an educational program that helped in the development of the staff. And right now we're talking about just the staff development. And this is in 1951. I think we had 5 or 6 interns, and they had, I think, 160, what does it say? 150 applications for 5 or 6 slots at Grandview Hospital. Now that's how sought after the educational programs at Grandview Hospital were in 1951. But it just so happened that in 1953, I think, we applied for a new surgical residency, internal medicine residency, OB residency, anesthesia. All of them got turned down by the AOA.
What year, Jim?
1953. All right, sir.
51, we had about 10 or 12.
Do we have 10 or 12? I apologize.
That was the first.
We had 10 or 12 interns that they applied, 150 slot people applied for. Dr. Sickinger right here was a member of that class, okay? Thank you, sir. Can't get any better than that. But what happened is, and this is extremely important in the history of this hospital, that the Bureau of Hospitals came down to Grandview Hospital and gave us a 12 or 13-page consultation report. And this is the consultation report. And the reason for it is the failure of Grandview Hospital to secure approval for required residencies in obstetrics, internal medicine, and anesthesia. And the failure to get approval for a second residency in surgery. And the definition of the problem is that there was basic educational problems that affected the hospital at all levels. Now, they went on to go through the whole philosophy, but I'm trying to show you some of what happened in 1953. They came down and they reviewed the Constitution and bylaws of the hospital, the entire corporate structure. They interviewed the president of the board. They interviewed the administrator. They interviewed all the department heads that were in need. They interviewed the staff. They reviewed all the inspection reports. We had failed 2 or 3 hospital inspections. And went on to, they evaluated our hospital from stem to stern. Now this shocked everybody at the hospital because of what I'd already shown you. All this stuff was going on, but bam, the AOA through the Bureau of Hospitals said, no sir, son, you can't do that. Now at that time, we were training people by preceptorship or assistantship, I think is what they called it. And the guy would actually pay the surgeon, say $1,000, and then bring all of his cases to the surgeon, and when he had enough cases under his belt, then he'd bless him and he could come on the staff and start doing that procedure. Now that was how you were trained by preceptorship. And the AOA wanted it done by residency. So this was a power play to try to change the whole profession because most of the education in our profession was like that. Here is the internal medicine review. The internal medicine department certainly is what I'm most interested in. They tried to interview Dr. Zimmerman, who was the department chairman, but now Dr. Zimmerman didn't show up for the interview. Now, one of the reasons happens to be down at the bottom where it says there was liberal use of the clinical lab. Now, Dr. Z had a check sheet with every cotton picking test known to man. So he would check off any number of lab tests, and they didn't like that. So I think he saw also, they were saying there's not enough consultation by the surgery department with the internal medicine department over critical surgical cases. You guys aren't talking to each other. And there probably was this. They say, we were assured that no personality problems exist between the 2 departments. Baloney. I don't believe that. Do you? I don't believe that. But what they were telling us, you get your act together. If you guys really want to get these residencies, you're going to have to get together and cooperate and consult each other. Because the same was true. Also, the internists weren't calling the surgeons when they should have. And patients were suffering because of it. None of the interns were being taken around to see patients with the doctors. They were just making do H&Ps and do scut work. Nobody was being really educated. And so what happened is that a special dinner of the Board of Trustees was held. Guess where? Over at Sutmiller's. All right? Now that board introduced 2 people, J. Paul Leonard and Carmen Pettipies. And both of those guys were working on the Bureau of Hospitals and going out and examining all of the hospitals in our profession. And they are the ones that came in and gave us that 12 or 13-page critique. So they met with the board of directors and told them all of this sad news. You got to do it this way. You got to restructure this. You got to do this. And after that, the board of directors adjourned and went to the staff meeting, which was at the Engineers Club in downtown Dayton, and told them how the cow ate the cabbage. And then they had a special meeting on April the 17th Here are the board members. These are the documents that Mr. Minor gave me, allowed me to have. You understand? And what did they say? They created a committee to go over the staff constitution, all the committee appointments, all the policing powers of the committees, all the departments, and they reshaped the entire structure of Grandview Hospital and how the hospital is run and managed. The staff executive committee came out of this. And how it related to the board. They said, look, doctors can't be going to the board and telling them they're angry about this or that. You got a problem, you go to the staff executive committee, and if the staff executive committee says it's legitimate, they bring it then to the board of directors. And they built up this chain of command. Before that, guys would get in a herd and go down there and hang on, bang on the door. But after that settled down, guess what? We're back 100 and something osteopathic students applying for 10 or 12 places, okay? Now, here is where the importance of our internship, our medicine residency, our surgery, all of our educational programs come in here. Interns now training Grandview will complete, Donald G. Burns, sitting right over there. Donald G. Burns eventually became the director of pulmonary medicine at Grandview Hospital. He trained all of the pulmonary people that practice at Grandview Hospital today. Came out of that one internship class. Came here because of the quality of education at Grandview. Right behind him, John Vossler went out to Eaton, set up one hell of a family practice. 3 children of his are still referring the patients into this hospital every day. Who else is on here now? Sampson. Sampson joined the staff, went out to Middletown, started sending patients. McCarthy had a big practice up here on North Main Street. Had his own problems later on. Sure referred a lot of patients into Grandview Hospital. Who else is there? Herzog did.
Bill Dowsett was a missionary to Ecuador.
Is he? Thiesing was here for a while. I don't know. Did he? But each internship class was like this. And a significant number of each of those that were trained stayed here and helped to build this place to be what it is. Now, Sampson. Now, I want you to note, this is January the 15th, 1955, and it's in Des Moines. And it said, "We'll gladly accept internship." The same cotton-picking day, January the 15th, 1955, Sampson signs a contract with Grandview Hospital to be an intern for $50 a month. Okay? Now that was in what year? That was in 55. So he was making big money over Charlie Moon, who come here in like 1942, was getting $10 a month. So in 10 years, it had gone up $40 a month. This is quite an interesting picture. Everett Wilson, he was actually the first intern at the present Grandview location. 1947, had just gotten out of the Marine Corps, came here as a bright-eyed intern. He later became the first ophthalmology resident at Grandview Hospital. Charlie Moon was the first internal medicine resident and also was one of the very first interns on 2nd Street. And FredOwers, was the first orthopedic resident at Grandview Hospital. And Dr. Spiros Gabriel, whose son sits here with us today, I think he was about the 5th surgical resident. You know that? About the 5th. And these other people, huh? Anybody? This is a surgical resident too. Who? Ackley. And then that's Panakis. Is that? He was anesthesia? Okay. All right, so I drew this little thing the other day because I'm kind of impressed about I am impressed that education and that Grandview Hospital have a symbiosis and they feed off of each other. And they both grow because they're both there. Now there's some typos here. This was quickly drawn and training isn't spelt right. And critical, somebody pointed out critical had a lack to see. I'll get this repaired, okay? I was probably drinking cognac when I drew this. Yeah, Napoleon cognac. But Grandview Hospital is blessed with excellent physicians in its early years, and I think that case that Dr. Dilatush did of that woman with that baby herniating his bowel right out through his umbilicus is an excellent example of the kind of guys that were driving this place early on. And he wasn't the only one. There were just others throughout our history. And they gave some excellent care to their patients, and this resulted in a large volume of clinical training material. And because of that, we had excellent intern and residency training programs, and we attracted excellent students that came here for those good programs. And we had large numbers of those people that went through these training programs join the staff, and that increased the volume of the hospital, and that gave us a strong hospital, which resulted in more good doctors practicing here. So that's the symbiosis of what I see as the educational aspects of Grandview and the osteopathic profession and the growth of our hospital that came from that educational program. Now, I want to run through a little historical stuff. This is the only copy of the Osteopathic Digest, which was the 2nd Street or Dayton Osteopathic Hospital newspaper. It was published in July of 1928, which is very, very early in the history of the hospital. If anybody has any copies of this of any year, I'll also like to copy them or get the information from it. Following that came Corridor Gossips. Now, I want to go back to Connell and show you how this guy operated, because this is not Grandview Hospital. This is Columbus Hospital, and they were in an old house. So that's the Columbus Hospital. And this is December 43, Corridor Gossips. Now, this is Grandview Hospital, 2nd Street, Corridor Gossips. It just so happened that Connell had a brother-in-law that owned a printing press. And guess what? Everybody got their papers published over there. Do you understand? One of the very first things, in fact, this is the paper in January of 47. Now remember, by March we're in Grandview Hospital, but in January they're still at 2nd Street, and they had hired Joseph Back to be the hospital administrator. That's Joe Back over there. But I just wanted to show you the similarity between the Corridor Gossips in Columbus and the Corridor Gossips here. The next paper that Joe Back developed was Grandview Hospital News. Now this is volume 1, number 1, June of 1947, and it says hello there, and they're published by Grandview Hospital, replacing Corridor News. And Joe Back got rid of Cano, okay, even his publications as time went by. By the way, anybody have any Grandview News? I'm in the market. All of this information I'm trying to disseminate tonight came, most of it, from these kind of documents and the minutes of the corporation. Next came the Osteopathic. Now that's pretty new, and so there are a lot of these around, but just look at this. Carla Myers and Robert Myers and Urs and what's her name, the little anesthesiologist, Sally Wilson. So these were coming as students, and at least in that one group, look how many stayed at Grandview. So we're benefiting constantly by these young doctors coming here for education. And then we went on to Grandviews and Southviews, and this was kind of interesting because this is the first meeting of Kettering and Grandview as they held their meetings to get together that ultimately wound up how we are today. Oh, we have our illustrious chief of staff here. She's sitting with us here today. Now, at everybody's seat, there's a list of the chiefs of staff. I thought the hospital had a list of the chiefs of staff. Believe me, I was shocked to find they didn't. Very great deal of work has gone into trying to develop this list. I still have some holes, as you can see. Anyone? Yes. Who? Still, I thought he was, but somebody told me no, he never was. Okay. So you think Sill was 89. I had him down and scratched him, okay? I want to try to make this as accurate as I can. I don't just want to put down a name because I think it is. But anybody can help me. If you have any information, please contact me and let me know so I can upgrade this list. Now, this is the list of the presidents and of the Academy, and I think it's fairly complete until you go back into the early 40s and 30s, so we might not be able to get that information. But if anybody stumbles upon any old document that can give us information there, I would appreciate it very much. I also am trying to develop a list of all the residencies. And in the handout you have, you'll see medicine residents, surgery residents, and and radiology residents, I think. But any residency, if you can give me lists of the people that have been in that residency, and if you can, the dates they were there, I would appreciate that very much. Now, we have some honored guests with us today. And the first of these I'd like to introduce is Miss Mary Agee. Now, Mary Agee came to Grandview Hospital in 1951. This is Mary. And Mary was a medical librarian, and she was given a room somewhere in a basement, down on the bottom, and a bunch of boxes of records were thrown in there, and she was told to get them all straight and make us a medical records place, which she started to do. She also was extremely interested in building a medical library. There were 8 or 10 old books on a bookshelf there that had been cast off by doctors as they went around. That was the medical library at Grandview Hospital. But Mary Agee went to the trouble to get money funding this, to have purchasing of new textbooks, and believe me, the library that exists at Grandview Hospital is a direct result of Mary Agee's work. Now, Mary Agee went on to write a book on medical records business. I don't know anything about medical records, but she did. Several pamphlets, and became known by the federal government. And they came to her and asked her to go to Liberia to establish good medical records in the hospitals and library, which she did. Now, prior to that, she became educated as a hospital administrator and went to Xavier University and was in the same class with Mr. Miner. And Mary Agee became the first female administrator, assistant administrator, at Grandview Hospital. So this is Mary Agee, and I love her. Thank you for coming. Now, Mary Blair, is she here? Mary Blair didn't get here, but Mary started in about 1955. She was going to try to be here. Somebody told me she got sick. But Mary was the personal secretary for Joe Back, personal secretary for Mr. Hunsaker, and personal secretary for Mr. Miner. So believe me, this lady has a great deal of knowledge of the history of Grandview Hospital. And I was hoping that she could be here tonight, but she isn't. Now, this young lady right in the center here is Joyce Holly. Joyce Holly is a nurse here at Grandview Hospital. Became our first enterostopy nurse and developed all the skin care programs and etc. that goes on. And Joyce is here. Joyce, would you please? There she is. And we love her too, and she just recently retired, and believe me, delivered a great, tremendous amount of health care to our patients in our hospital. And also, here is Phyllis Riddle. Now, Phyllis started working in the emergency room in 1968, and when they started the paramedic program of the Dayton Fire Department here in Dayton, Phyllis was running the emergency room at Grandview. And they hired her to work for the city, and she developed and ran the paramedic program that exists in Dayton today. When you see a paramedic going down the street, this young lady right here, Phyllis Riddle, developed that whole program. And I love her too. I don't have any other important guests, and I don't have anything else to say, but certainly I'm seeking information. I didn't say anything about congestive heart failure, did I? The heart is a pulsatile organ. It sometimes gets sick. It every now and then needs medicine. I hope that... Are there any questions about Grandview history? Yeah.
Forgot to say the reason the osteopaths went ahead during the war was because we weren't allowed to go into the service, and the MDs did, and we got all their patients.
Right. There's an aside to that. Dr. Schubert, who was our second real surgeon to join, or one of them, probably the second, he was residency trained to some degree anyway. Dr. Schubert had fostered himself off as an MD over in, I think, Kansas City, and got into a surgical residency program until they found out that he was a DO. Poof, they kicked him out. But that was right at the time the war was going on, so they thought he was an MD, and they drafted him. And so he wound up having to serve, I think, as a pharmacist mate or something. They wouldn't let him serve as a doctor, but they made him serve as, because they went ahead and drafted him because they thought he was an MD. And once he got drafted, then hell, he's in. So he served as a pharmacist mate. Yeah.
He graduated in 1939 and was practicing somewhere in south of Dayton, and he also went into the Navy as a pharmacist.
Did he? Did he volunteer or was he drafted?
He was drafted. He was he came back and did his internship, I think with or following Charlie Moon.
Yeah.
He was also one of the guys that was carrying the litter that fell down
Up
the
to,
stairs.
yeah. I heard him tell the story about the one they dropped.
Yeah.
Mel Krause had a meeting one time of some of the older men, and he told that story, and it's on videotape. I happen to have a copy of that videotape. Any other questions? Yes, sir. Art.
What happened to the suturing of Grandview Hospital by Miami Valley Hospital prior to the marriage to Kettering Hospital?
And if I know. I really don't know, Art. Does anybody know that history?
Yeah, I can probably answer that. I was chief of staff at that time. What happened was the Valley came to Grandview Hospital and started to negotiate with Grandview Hospital for the suturing to get together and everything. It was actually a wedge to drive Good Samaritan Hospital in with them.
So it wasn't a real true offer.
No, absolutely not. It was just to absolutely get the wedge drawn. Because Miami Valley did call on Friday morning. I remember the morning. I got the call, and Dr. Bill or R.J. Miner got the call. And everything was off. We're going to sign the papers this morning. That was like 8 o'clock in the morning, 9 o'clock the papers was off.
That is correct.
Yeah, that's right. That's right.
I didn't know that. When I showed you that deal about Pettipiece and Leonard coming down and saying, you're going to have to shape up your education program, they restructured everything, and they said right there in that critique, your physician should not be voting members of the board. And that was the beginning. Now this, I had a long discussion with Dr. Burns the other night. This apparently was happening throughout the nation, both professions, and was probably driven by the federal government that wanted these hospitals managed by administrators and didn't want doctors managing. So we just were in part of what was the evolution of medicine at that time. But if you go back, that's when it happened. Does that answer that question? Okay.
We were also the first nuclear lab.
Yeah. We want to try to have a section in the book on that, about Zimmerman and his lab. Yeah. Right. Let me say one thing. There is I started this project about 10 years ago, and I remember Dr. Quinlevin and I had dinner together one night to discuss this project, right, sir? And he encouraged me to do this, and I thought, oh, hell, I'll get this done in 2 years. Man, that was 10 years ago at least. I am not beginning to touch what's out there. There is so much information, there is so much that we don't know, that I am nowhere close to finishing this project. This is a real tremendous work. Yeah. But it's a lot of fun. It's just that there's a tremendous, there's no way I can discuss everything that needs to be discussed in an hour and a half of a lecture, you know. Well,